careful with these patients. So now, and see, I lifted the table too, so it's easy for me to work with. And I'm going to try to move as much as I can with my feet, not my hands. So I come in now, I draw the curtains, I raise the bed up, and now I put on my glove, and I am ready now to start catheter care. I pick this up. And the first thing I'm going to do before I do anything is what? Inspect the area. Now this person has a catheter, so you have to be careful that you don't pull it out. I'm going to take this catheter and I'm going to put my index finger on one side of the vaginal area, my thumb holding the catheter on this side with the catheter and opening up the vaginal area, and I'm looking. Mrs. Jones, everything looks wonderful. We can start now. I now take my one glove, my one washcloth. I wet it, I soap it up, and I start with the thigh and the groin area. And I always start on the body part that's furthest away from me. So I'm going to wash the groin and the thigh, the groin and the thigh, and I have to change this washcloth because, excuse me, I can't put it back in here because this has soap on it. So nurse evaluator, I'm going to change the washcloth. If she says you can just tell her when you're going to change it, which I'm sure she will, just keep it on. But say now I have a new washcloth on, I put it in the water, and I take off the soap, and I pat dry the area. I would throw this washcloth out, get another one, wet it, soap on it. Now, I have to hold, if you're writing when you're doing catheter care, you use, to me anyway, I have to use the opposite side because I'm standing on this side. I now take this catheter, I'm going to hold it away from me, and I'm going to go down one side of the labia, and I am now saying to the person, but I'm really telling the evaluator, I am changing the location of my washcloth. That is important, ladies and gentlemen. That is a checkpoint. So I'm going to move this over slightly. I'm going to hold the vaginal area open. I'm changing the location of my washcloth, and I'm going down with the soap. I'm getting rid of this washcloth. I'm getting a fresh one, water, and I am now taking the soap off. I am taking the soap off, changing the location of my washcloth. I throw this away, I get another washcloth, I put soap on it, wet it, soap on it, and I'm going to open the vaginal area. I'm going to go straight down, straight down. See how I took the catheter and put it, it was down, I picked it up and went down the rest of the vaginal area. I throw this away, I get a fresh one, fresh water, and I take the soap off. Now I am ready to wash the catheter. I get a washcloth, wet it, soap it. I am holding this catheter as close to the meatus as I can get it. The meatus is what? The opening at the end of the bladder where the urine comes out of, right? Okay. I'm going to go straight down about 4 inches. That's all. That's it. I'm now going to let go. I get another washcloth with plain water. I hold it again at the meatus. I wipe the soap off, and I am now finished with catheter care. I am gently pat drying the labia. I'm going to dry the catheter. And now, Mrs. Jones, we are finished. I am not walking away and putting this in here. I'm holding this and I'm covering her. And now I'm going to put this in the hamper. Now before I actually take this blanket off you, Mrs. Jones, I want to check the urinary drainage system. So I'm just going to look at everything. Everything looks wonderful. There's no kinks, there's no breaks in this tubing, no leaks in the bag. Everything is wonderful. Mrs. Jones, I'm just going to unravel your legs now. Do you feel nice and refreshed? Wonderful, Mrs. Jones. I'm happy to hear that. I'm happy that I could make you feel nice and comfortable. The next thing I'm going to do, Mrs. Jones, is I'm going to take your gown and put it down. Okay, Mrs. Jones. So I'm going to just take this down to your knees, and I'm going to pick up this sheet. Cover you.
Over there, Franklin. Franklin.
What happened to Franklin? I'm taking this away from me, ladies and gentlemen. This goes away from me. My patient is nice and comfortable. Always goes away from me, and it goes in the hamper. Now I'm here at the foot of the bed. What am I going to do with my knuckles? First thing I'm going to do I have to bring the head of the bed up? No, the head is fine. I'm going to make sure that the bed is lowered so my patient is nice and safe. Mrs. Jones, it's a female. Mrs. Jones, do I have permission to go into your bedside stand? Thank you. I want to put the soap away. I'm going to make sure that your room is nice and tidy before I leave. Are you comfortable, Mrs. Jones? Is there anything that you need while I'm still here in the room? No? Okay. I'm just going to be getting your bedside table back down near you so you can have your remote control here and your telephone and your tissues. Okay. All this would go where, ladies?
Garbage.
In the garbage. Everything would go in the garbage. I'm not throwing it in the garbage because I want to use it again. This would be where in the hamper. I would put this away. While I'm here, once this goes away, I would open this curtain. I'm here. I open this curtain. I've asked him if he's comfortable, if he needs anything. I told him I'll be back, blah, blah, blah. I go. This goes where, everyone? In the commode. I take a clean barrier, I put it down. I rinse this with my gloves on. I put soap in it. I have the bubbles. I get the soap out. I put this on the clean barrier. I dry it. I remove my gloves about an inch below the cup, inside out, 2 fingers under the cup. I wash my hands. I shut this. I get a barrier. Knock, knock. I'm back, Mrs. Jones. I have your nice clean basin. Do I have permission to go into your bedside stand? Thank you, Mrs. Jones. Mrs. Jones, are you comfortable? Is there anything you need while I'm still here in the room? Should you need something when I leave, just ring your call bell and someone will come in to assist you. Don't laugh. What happened was the first time I was setting up, maybe not the first test, but I was setting up for the state to come in. And one of the other nurses came in, she goes, Lucille, she said, I just found out that we can't use the little ding-ding signal bells anymore. You know, we had